Cancer rates in Kentucky are among the highest in the country, and we actually see that within the prisons here in Kentucky. Our patient population in the Kentucky DOC is a little bit over 24,000 patients, and anytime one of those patients is diagnosed with cancer, their information is brought to the oncology team here at KSR.
I was working out and I noticed one of my calves was extremely larger than the other one. Extremely large, like softball size difference in the two. Had to see various doctors till we actually found a doctor who knew what it was.
I started to have this feeling like I wanted to throw up. And after a couple of days, it kind of subsided. It came back again, started again, and I went to the hospital. And after x-rays and scans and whatever, they determined that I had cancer in my gallbladder.
Mr. Dixon came to us last fall, and this old man just walked in, and he was quiet, didn't really speak to anybody, was a little nervous on, should I let these people touch me? And we just hit it off right away.
About a month had passed, I went back to see the doctor. He said that my biopsy had to be sent off to Harvard University Medical Center to ensure that they were positive of what they were looking at. And he told me I did have cancer. Bad cancer.
His biggest thing is he felt like people were keeping things from him, because one day he's fine and the next day he has cancer. So that was the biggest thing, is I don't feel I can trust the healthcare providers. Are they really looking out for me? Or if something happens to me, will I just be one less person they have to take care of? If you trust me and we go through this journey together, I will tell you everything you need to know. And I'm like, I assure you in this program, you will get the best care.
Well, they pretty much took care of everything. Ms. Garth and her team and my doctors, they come up with the chemo treatment plan, and of course we had the radiation treatment plan, and everything went pretty smooth. I mean, you couldn't ask for much more, considering the situation and the circumstances and everything like that. They were very comforting. They were reassuring.
And once they started to explain, the team started to explain to me my ins and outs and all that involved chemo treatment, I thought, man, I'm in pretty good hands right here. As a matter of fact, she says, you belong to me now, so just, and that made me relax. I had a really good outing the first time, and from that point on, it's been nothing but compassion, concern.
The relationship you have with the team around you it's important. There's a trust factor. There's the not knowing. There's so many factors, and you have to be able to put your faith into something, into somebody.
Being an oncology nurse, it's just a different connection with your patients. You have not quite as many that you interact with, and you get more on a personal level with them. You're able to actually sit and communicate and learn their life stories and learn how they got here and how they're feeling. And these guys trust us more than probably they trust most.
And the treatment started. I came here Mondays for labs, Thursdays for treatment, and of course all the chemicals that was being put in and all that. It was just, hey, it was like a walk in the park, just to be sitting in these chairs here, kick back, relax, knowing that I was in good hands.
I went through 25 radiation treatments, and you could never tell no difference. And then immediately my calf overnight shrunk in half.
He was really amazing. I mean, I try to be positive in every case, but in his case, it looked really gloomy because if you could have seen his leg beforehand, it really looked like we were gonna have to take so much tissue out that he wouldn't even have a leg.
And it was just like everybody was on point with what to do, because 4 weeks later I was in surgery, but they had to take a significant part of my leg out. But I got a leg.
But when they give you prognosis, the prognosis is based on what normally happens in a situation like this. But every situation is difficult. You could be that success story that walks out of here. And so that's why now when I see him on the yard, I'm like, look at you standing on your legs, both legs, and walking. and running and that sort of thing. And he never thought in a million years he'd walk again.
I feel like I've been well cared for. And I don't see how I could have gotten any better treatment, even if I was a millionaire in the free world. I couldn't have paid for a better treatment than I've gotten.
If my family member was here, I would want to make sure that they're getting adequate care and exceptional care for a patient that has, or a family member that has cancer or any other ailment that they may come across.
The way I feel about the people that provided this care for me, I'm extremely grateful. I feel like Ms. Garth and her team had a hand in saving my life.
Oh man, there's not enough words to say. I mean, thank you is simply not enough, but it sort of comes down to thanking. As a matter of fact, I feel like I owe my being to both of them. My name is Thomas. I'm 75 years old, a survivor of cancer.
You can't say enough about someone who's played such a pivotal role in literally changing the outcome of your life. So, I mean, my hero. I'm Paul Martin, and I'm a cancer survivor.